HPV vaccination is a preventive measure against the human papillomavirus, HPV, which is a common sexually transmitted infection, STI. HPV can lead to the development of several types of cancers, including cervical, anal, vaginal, vulvar, penile, and oropharyngeal cancers. The vaccine works by stimulating the body's immune system to produce antibodies against the virus, which can help prevent infection. Who should have HPV vaccination? The HPV vaccine is recommended for both males and females aged 9 to 45 years old, though the exact age at which the vaccine is recommended may vary depending on the country and the specific guidelines in place. In general, the vaccine is most effective when given before an individual becomes sexually active, as it can protect against the types of HPV most commonly associated with cancer. How effective is HPV vaccination? Studies have shown that the HPV vaccine is highly effective at preventing infection with the types of HPV most commonly associated with cancer. The vaccine has been shown to be up to 97% effective in preventing cervical precancerous lesions caused by HPV types 16 and 18. In addition, the vaccine can also provide some protection against other types of HPV that can cause cancer or genital warts. What are the side effects of HPV vaccination? Like any vaccine, the HPV vaccine can cause side effects, although these are usually mild and short-lived. The most common side effects include pain, redness, or swelling at the injection site, as well as headache, fever, and nausea. More serious side effects, such as an allergic reaction, are rare but can occur. What are some common myths about HPV vaccination? There are several common myths and misconceptions about HPV vaccination that can discourage people from getting vaccinated. Some of these include: myth: HPV vaccination is only for girls. In fact, the vaccine is recommended for both males and females, as both can be infected with HPV and can pass the virus on to others. Myth: HPV vaccination will encourage sexual promiscuity. Studies have shown that HPV vaccination does not lead to an increase in sexual activity or risky sexual behavior. Myth: HPV vaccination is not necessary if you are in a monogamous relationship. Even in a monogamous relationship, there is still a risk of HPV infection, as the virus can be dormant for years before causing symptoms. Myth: HPV vaccination is not safe. The HPV vaccine has been extensively studied and has been shown to be safe and effective. The vaccine has been approved by regulatory agencies around the world, including the FDA in the United States and the EMA in Europe. In conclusion, HPV vaccination is a safe and effective way to protect against the human papillomavirus, which can lead to several types of cancer. The vaccine is recommended for both males and females and is most effective when given before an individual becomes sexually active. While the vaccine may cause some mild side effects, the benefits of vaccination far outweigh the risks. It is important to educate oneself about the facts regarding HPV vaccination and not be swayed by common myths and misconceptions. In conclusion, HPV vaccination is a safe and effective way to protect against the human papillomavirus, which can lead to several types of cancer.